Unless you've been living in a cave for the past few months, you have certainly heard the word Ebola. Hi, I'm Roger Follebout, Community Relations Director at Peninsula Regional Medical Center here in Salisbury, Maryland. So, what is Ebola and why are hospitals preparing for it? At our hospital, Peninsula Regional, on point when it comes to Ebola is our Chief Nursing Officer, Mary Beth D'Amico. And Mary Beth is with us on the program to discuss Ebola today. Hi, Mary Beth, welcome.
Hi, Roger. Thank you. It's a pleasure to be here.
Great to have you here. We should point out we are taping this program in late October of 2014. If there's one thing that we've learned about Ebola is that policies, procedures, best practices seem to change almost weekly with this virus. So, we're going to give you some great information on the show today, but for the very latest information, we encourage you to stop by our website at www.peninsula.org. Right there on the Peninsula Regional site, right on the homepage, we have an Ebola banner. You can click on that, get the very latest information about what we are doing to prepare. And also there's some great links on there as well from state and federal agencies like the Centers for Disease Control and Prevention to get the very latest information about Ebola. Okay. So now we're up to speed. Mary Beth, back to you, and again, thanks. So tell us, what is Ebola?
Roger, Ebola virus disease is a disease that originated out of Eastern Africa in the 1970s. And it is just that, it's a virus. And it's a virus that when a person is exposed to a person that has Ebola virus disease, that they can develop symptoms. They can develop symptoms within usually a 21-day incubation period. And normally those symptoms start with profound weakness, muscle pain, abdominal pain. Fever is a characterized symptom of Ebola, and what we know about that is the temperature usually is above 100.4. In addition to that, patients that have been exposed and have the Ebola virus disease have diarrhea and they have vomiting, and at some point, either late or early in the disease, they can also have bleeding or hemorrhage. And it is a virus that is contracted by blood and body fluids. It's not an airborne virus. And so that's one of the things that we have learned through the Ebola cases that we've had on the U.S. soil over the past few months, is that Ebola is staying true to the science. It is a blood and body fluid contracted virus.
Is it easy to contract, would you say?
It's not easy to contract because what we know is that for someone to become infected with the Ebola virus disease, there has to be a blood and body fluid exposure. And what we know is that is by form of a needle stick or very close contact with blood, saliva, any type of effluents or body fluids from a person that has Ebola. It's not contracted by casual contact or even being near someone with the Ebola virus. It actually has to be an exposure that puts a person at high risk for contracting the virus.
As I mentioned in the opening, you hear a lot about Ebola now. And we've been hearing a lot for the past few weeks. And it seems like the media has really put the nation on full alert about this virus. Warranted, in your opinion?
I think any time that there's a virus that has these type of outcomes in Africa, that folks are going to have some natural anxiety. But I think one of the things that's important to remember is really the science around Ebola and knowing that it certainly is a blood and body fluid exposure a virus, and that's how you contract it. And also the fact that knowledge, I think, will help folks relieve some of that anxiety, knowing that close contacts of individuals that have even had Ebola have not contracted the virus. Mm-hmm. It really does have to be in close, it has to be with an exposure. So I think it's important for there not to be chaos and hysteria and panic about this. And as you mentioned earlier, the references, the CDC websites, our local health department, as well as our own website at PRMC can help us not have that fear and not have that panic about contracting the Ebola virus disease.
Sure. You and I both know that the flu here in America has the potential to kill literally thousands of people this year. So really, shouldn't we be as vigilant about the flu, or maybe even more vigilant about the flu than Ebola, however Ebola is getting all of the headlines lately?
Yes, I definitely think that with regard to the flu, we've already had cases of the flu in Wicomico County, and it is flu season. So we are advocating for the flu shot. for patients to certainly, and for the community to be aware that the flu does ultimately kill more individuals in the United States every year. Certainly we know that anywhere between 4,000 or 40,000, depending on the epidemic, people have died from the flu. So the flu shot is the best protection against the flu, as well as simple things like hand hygiene. Washing your hands, sanitizing your hands with alcohol sanitizer. Those are all things that are important that the community can do to reduce their risk of having any flu symptoms. And they are common, and certainly, again, whether you have underlying respiratory disease, sometimes can cause quite a bit of health problems.
Sure. Still, it is essential that all hospitals across the country, including PRMC, be prepared. So tell us a little bit about what we've been doing, and I know this has really been on our radar since dating back to the summer.
Yes, it has. We actually started planning around this and talking about it in our teams and our groups back in the summer, really before we had an Ebola case on the U.S. soil. And we noticed, our infection prevention clinicians actually noticed from the CDC website and also their contacts through the health department, there was an uptick in Western Africa of Ebola cases. And what we know about that is we started planning, and we started using the CDC checklist for hospitals being prepared. And while it seemed remote in the summer that we would even experience that on the U.S. soil, we started that checklist and started preparing what it would be like if we had to prepare. So when we actually did have a case in the United States, we had actually gone through many of the steps that the CDC was recommending early in the process. And so that allows us a level of preparedness that from being prepared early in the summer that we've been able to just build on as more information and guidance has become available.
Sure. So where are we today in our preparations?
We're prepared from the standpoint of we know that one of the most important things that we can do is to make sure that we screen patients that come to the hospital or come really to any portal within the hospital for symptoms and also travel history. So one of the things that we're doing as soon as the patient presents, we're asking about travel history, and that travel history is particularly to Western Africa, and it's travel history over a course of 21 days prior to their arrival. And we're also matching that with symptoms. Certainly the symptoms of Ebola as well as the travel history would require us to immediately place that patient in isolation. And it would also require our staff to protect themselves with proper protective equipment. And certainly we know that that's part of our role as a hospital for our community is early detection. We have to be able to identify patients that would come to us that are high risk.
Equally as important, I would think, is that education piece, not only for the community, but for our staff as well, so they know how to properly react. So I'm assuming that a lot of time has been put on the education piece and training and drilling and preparing.
Yes, one of the things that's pertinent for the employee is the proper equipment to wear. We know in cases that have occurred in the United States, the equipment itself has been implicated as part of the reason why the Ebola virus may have been contracted by those healthcare workers. So what we've done is we have exceeded guidance in many ways with regard to the protective equipment our staff would wear. And we've been training on that because what we know is the care of the Ebola patient during the process of caring for the patient is not the highest risk. The highest risk is actually removing the protective equipment after a staff member has been in the room for a prolonged period of time and removing it safely without contaminating themselves. So it was very important for us to get the proper equipment that was recommended and also train our staff how to remove that equipment safely so that they don't expose themselves. And then of course, without having an Ebola situation or actual patient, we actually have to drill. So we spend time drilling and practicing, doing walkthroughs, what it would look like for a certain scenario to happen.
You mentioned the donning, putting on of the personal protective gear, and doffing, taking it off.
Yes.
Why is that training so important?
It's important because what we know is that there's multiple steps to putting on the equipment. There's about 28 steps in our process to put on the proper equipment. And we also know that we use the buddy system for that. That was actually a recommendation that we saw and heard about from the national centers that take care of these patients, infectious disease patients. They actually use a buddy to make sure that a person doesn't forget a piece of equipment. that everything is appropriately fitted, and that all skin is covered. So that's an important part about donning or putting it on. In terms of doffing or taking it off, that buddy system again is important, because what we know is that we want to make sure that staff have the right training about taking off the gowns, taking off the headgear. They're double gloving. They also have boots and protective footwear. And also, our process includes the staff member decontaminating themselves by showering. So there's quite a bit to the donning and doffing process, and it's something that our staff are our most valuable resource, and we want them protected going in the room and coming out.
You mentioned earlier a word that I want to go back to, which I think is very important for everyone watching the show to hear, and that word was remote. The very remote possibility that an Ebola patient would present at Peninsula Regional. If that happens, can you kind of walk us through the process of what you would do and how the alarms would go off and what procedures would be followed?
Sure. Immediately upon arrival, we have our greeters in our emergency department, as well as other entries and portals of entry into care, asking questions about travel history. If that patient presented with a positive travel history of going to a Western African country over the last 21 days, and also symptoms, we have a series of alerts that would take place. And the alerts that would take place would notify individuals in our organization and leadership, as well as our infection prevention specialists, as well as physicians, so that we could actually respond very quickly. That patient would have a mask on immediately upon noticing, or us noticing that was a positive travel history and symptoms, and they would be placed in isolation. And our staff would immediately be placing their equipment on so that they could safely go into the room and assess that patient. And then certainly what we have to do after that at that point is we actually have to contact the health department, who is our community partner with regard to the public health concern. And they actually tell us, based on questions and scenarios that they have, whether or not the patient is a person under investigation. So that guidance actually comes to us from the health department, as well as from the CDC to the health department. If the patient does indeed need to have testing done, that blood sample can be drawn at our facility, and we would actually send that blood sample to our state laboratory. Certainly what we know is that the guidance right now is that there are 3 centers in Maryland that would care for Ebola patients or persons under investigation for Ebola, and that indeed that patient may transfer to one of those facilities very quickly. However, what we know is that we want to be prepared. So we've actually taken steps to actually follow that patient and trace that patient through an actual 3-day stay. We may even have to care for that patient till discharge. So we're prepared for all of those scenarios. We have the equipment, we have the knowledge and the training, and we stay in constant contact. We actually have a daily Ebola preparedness meeting in the organization, working with our local health department, working with our community, as well as working with our internal staff members and our internal leaders to make sure that we're prepared.
You know, another thing that is of interest, I think, to a lot of people is what happens after the patient leaves the room? The waste that's generated, the equipment that's used in the room, how is that handled?
Yes. What we know from the, information from Texas, as well as information that we've gotten from some of the major centers in the United States that care for these patients, the production of waste with regards to sheets and bedding and everything that would interact with the patient, there's quite a bit of waste. And caring for the waste of an Ebola patient is quite different than any other type of patient that we would normally care for. There is a process of double bagging waste, as well as wiping the bags down and actually putting those bags in a container. And those waste bags would not be removed from that room unless by a special process and until we actually had someone come and remove that waste. It isn't waste that would end up in any other part of the hospital or in the community.
Sure.
There's actually ways of processing that waste that are specialized.
I think the main question, and this will be the last question too, Mary Beth, I think the main question probably on everyone's mind watching this program right now is how concerned should we be here in the Salisbury area about an Ebola patient presenting at Peninsula Regional? Clinically, what's your thoughts?
We know that it's remote. We know that just what our nation has done with the airports and making sure that passengers are screened from high-risk countries. We know that it is highly unlikely that a patient is going to end up at a Salisbury airport or end up coming from a Western African country without any level of surveillance. So I think nationally we've done a good job with that. But I do think that certainly one of the things that folks worry about is what that patient that would come that you wouldn't have any idea. And what I would say with that is we are certainly prepared for that. We do not want the community to be concerned about our level of preparedness, but it is remote. And that's something that I think is important to remember and to continue to do things in our daily lives that we would normally do. Because again, it's not an airborne disease. It's not an airborne virus. It's by blood and body fluids. So even casual interactions, even if there were a patient, that wouldn't be a risk point for our community.
Mary Beth, thanks so much for coming on the program.
Thank you, Roger.
And speaking with us about Ebola. Great information, and we do appreciate you being here.
Thank you, Roger, for having me.
And that'll do it for this edition of LifeWorks PRMC. Again, we'd like to thank Mary Beth D'Amico, our Chief Nursing Officer, for being on the program with us and sharing such valuable information about Ebola. Again, as we mentioned at the beginning of the show, procedures, policies, best practices seem to change almost weekly with Ebola. So the best advice we can give you is to stop by our website at www.peninsula.org. Right on the homepage, you'll find an Ebola banner right near the top of the page. If you click on that, you'll get the very latest information about what Peninsula Regional is doing to prepare, and also, as I mentioned at the beginning of the show, some really valuable links to local, state, and federal agencies where you can grab some interesting and very, very effective, efficient, and informative information about Ebola. So until we see you again on LifeWorks PRMC, thanks for being with us. Thanks to everyone here at PAC 14, and we'll see you again soon.